I'm going to move on to oral nasal fistulas kind of quickly because I think that CT is a must in these cases to look for small pieces of material that can be left behind. So we'll move through these slices here, and we can see that there is a piece of material laying here. They had to have a patch or kind of a rubber plug over this horse. We have some gas in this fistula as well. And then we have a small piece of dental material still left up here. So CT is really sensitive for these small little pieces of dental material that can be left behind, and really help and guide you into what you need to do. In this case, that was all debrided and cleaned out well. And then we ended up using one of those Protemp bridges on this horse again to help it to seal up. This is about a 9-year-old jumper that had a 10 extracted, and then subsequently it was a clean oral extraction, but subsequently then developed a very large oral sinus fistula. Radiographs are shown here in the dorsal to ventral oblique and our dorsal to ventral here. And really where you can kind of see the fistula was this region right here on a ventral to dorsal, looking at the palatal view of these cheek teeth. So we knew we had a problem clinically because we could see that there was a fistula. You could flush into it and have her come out her nose. This horse was hauled from the West Coast out to us. When we performed the CT on her, it's when we could really see the extent of this. And we had a big tract running up into her sinus. This is a polyvinyl siloxane plug that's in there. And what I find with these in these cases is that the plug does keep the majority of the food out, but it also acts like a pump. So when they're chewing on that, they're actually just pumping things around it and pumping food up through it. And I think that's why when we put these solid, hard bridges in these horses and bond them to the teeth, that we actually help to stabilize things here, and it doesn't act like a pump. And then it also puts pressure on the bone, so they're chewing on it. And because it's amazing how fast this bone will fill in. So we can see the fistula here on the dorsal view, but we put a fistula in this horse. 2 days later, we put her back on full hay and feed. And then we continued to flush her sinus to treat the sinusitis for 2.5 more weeks. Then we pulled the tube, we scoped her sinus again. She was clean. We left the bridge that we placed in here for 2 months, and then we cut the bridge out, re-CT'd her, and at that point, this bone was filled in, and she no more had a tract from her mouth to her sinus. And then we reinstalled the bridge just to be safe and sent her home. So she's now back. That was done in December, so she's now back home in the West Coast, back in full work. And she'll probably wear that bridge for the better part of the next year to 18 months. The longest I've had a horse wear one was 18 months.